Research reported in the National Post shows evidence that chiropractic care may make a valuable contribution to a wellness protocol for patients diagnosed by a medical doctor with diabetes. What does the back or spine have to do with glucose levels? Messages sent and received by the brain through certain nerves that exit the spine in the upper neck and middle back help the pancreas to function properly. When the spine is misaligned in these areas, information flow can be inhibited, reducing or disabling ability of the pancreas to produce enzymes that digest proteins, fats, and carbohydrates or produce insulin. This could cause glucose levels and digestion to become unbalanced, contributing to symptoms of diabetes. Today, Dr. Daniel Brannigan joins us to discuss how chiropractic techniques are evolving and the potential benefits of integrating them into an overall health maintenance plan for diabetes. From Peninsula Television, this is Diabetes A1c Forum. We're here with Dr. Brannigan. Dr. Brannigan, welcome to Diabetes A1c Forum.
Patrick, thanks for having me.
So, in the early days of chiropractic practice, were adjustments to align the spine more effective in addressing certain health issues than today?
That's an interesting question. Theoretically, when you talk to older chiropractors, they'll say, back in the day, you could do an adjustment and the impact on the body was by far greater. Mm-hmm. Now, we talk a lot about detoxing because we're inundated with so many chemicals that the body has a delayed response to the adjustment a lot of the time, or it takes a lot more adjustments for the impact to occur. So I don't really, the other side of the question is I don't really like the idea of realigning the spine because I don't think that that's an accurate description in what we do as chiropractors. So for me, it's really about the nervous system. So it's about bringing integrity back to the nervous system. So when you make an adjustment, you're actually firing the nervous system to different parts of the brain.
Okay.
So when you think about chemicals interfering with that process, I think that's what's really occurring. The difference between today and 100 years ago.
Oh, that's a complete different perspective than most people you talk to when you ask them about chiropractic care.
Yeah, a lot of times we talk about, there's two different styles of chiropractic. Yep. You've got your straight model, and then you have your mixer model. And the straight chiropractors are really the foundation of chiropractic. They stick to the bare bones of chiropractic. Their philosophy is it's all about a subluxation. A subluxation means more like joint dysfunction, and they want to correct that joint dysfunction, bringing integrity to the nervous system. A mixer will recognize that sometimes it's just not enough, so they use other modalities like ultrasound, diet changes, supplementation, therapeutic lasers, that sort of thing.
Interesting. So, which of the types of chiropractic care do you practice?
I'm probably falling in line more with the mixer. Throughout my practices the last 10 years, I have noticed that I've had patients that just don't get better. So with the mixers, they're focused more on the patient and the patient getting better for whatever it is that's ailing them. With the straight chiropractors, a lot of them don't care about symptoms and they don't care about fixing the person's pain or disorder per se. Their focus is to, to relieve the subluxation. They want to be subluxation free and then allow the body to do what it does as it was designed to do. We have the same philosophy as a mixer, but for me personally, I focus on, I want to turn on the right buttons per se in order to get the greatest response. So in other words, the way that I practice is I'll do a neurological exam, I'll do an adjustment, and then I recheck that exam to see was there a change for the better or not? And then that gives me the ability to allow, am I doing my job?
It sounds like as a mixer, you try to understand patients from a more overall or holistic perspective when you see each one?
I do. one of the things that I've noticed personally is that as people, we're not getting healthier, we're actually getting sicker. And so I practice in a very, very, very small town, and so I get a lot of different issues coming through my practice, not just my back hurts, my neck hurts. A lot of times I will catch autoimmune disorders. And I know this is a talk show about diabetes, and diabetes is an autoimmune disorder. So I work with those kinds of things, and there's a need for that. And so I have had to, almost by force, change the direction of my practice to help these people. My focus was really to make a change, make a difference for people, and that's sort of where my chiropractic journey took me.
Interesting. So with regard to diabetes, type 1 diabetes, for instance, is an autoimmune disease. Could you talk about a little bit about the immune system and how it functions normally, like a Th1 and a Th2 response, what that is, how it works?
So what an autoimmune disorder is really, by definition, is that your body is attacking normal tissue. And we can sort of expand that definition by saying, well, what really is occurring is that your immune system is attacking normal tissue. So a part of your immune system kind of works like this. I mean, our immune system is very complex, but the response of our immune system is sort of broken down into two systems. You have a Th1 and a Th2 system. So to make it simple, let's sort of illustrate it like this. You can say that the Th1 system is kind of like the military system. So in other words, think of the Th1 system as the Marine Corps. So the Marine Corps goes out through the body and it looks for bad guys to kill. And that's pretty much what the Th1 response is. The Th2 response is sort of the identifiers of that system. So they go through and start tagging good guy, bad guy, good guy, bad guy, so that when the Th1 goes looking, they can identify who is the good guy versus who is the bad guy. So that's kind of the distinction between what the difference between Th1 and Th2 is.
Interesting. So with regard to the immune system, can you describe, if you have an autoimmune disease, what happens to that system, the Th1 and the Th2 system?
Let's just say that, for example, you're in a crowded bus and somebody sneezes and you get inundated with a virus, okay? So the Th1 system will fire up and it'll go out looking for that virus. And a lot of times what happens is that Th1 system will catch that virus and destroy it before you even have any symptoms, okay? If it's a big virus or you have a weaker immune system, what will happen is the Th1 system will go out and try to attack that virus. And let's say that it can't, and it runs for 8 to 24 hours. At that point, what will happen is the Th1 system, the body will shut it down, and then the Th2 system will go into action. And basically what that does, like I was talking about before, it's sort of the identifier. So it'll go through and start recognizing bad guys versus good guys, and on the bad guys, it'll create antibodies. And those antibodies will surround that area, and then that'll shut down after 8 to 12 hours. And then the Th1 will fire again, and then it can see, oh, now I know where I'm supposed to go and who I'm supposed to get. And then that will continue. And then that's pretty much what happens with your Th1, Th2 system. It's kind of a teeter-tottering system that goes back and forth. In the case of an autoimmune disorder, it gets a little more complicated. So let's take, for example, that you've got a really tricky, small bacteria. Bacteria typically are too big to enter a cell. So, but you've got these tricky ones that are smaller, or a virus might be a better example, where a virus is small enough to penetrate the cell. So what happens a lot of times is the virus will penetrate the cell and it'll turn on a marker. So that cell will have a marker or an identifier where it can be identified, and that's where it knows who to get. A lot of times these viruses will go into the cell and it'll disengage that marker. Now the immune system is confused because it knows that there's something wrong, but it can't find it. So think about in terms of, you have robbers that go into a bank, okay, and it's going to rob the teller, and the teller pushes the alarm button, and everybody knows what's going on. In this example, what's happening is the teller is pushing the alarm button, but there's no message getting to the police station. So now you have this havoc going on. What can happen is that everything is confused, and then For example, the Th2 system can start creating antibodies to normal tissue. So for example, let's just say a female is inundated with some sort of heavy metal like lead. And she's been a painter for 20 years and she's got lead in her system and it's accumulated in the fat cells behind the thyroid. Your Th1, Th2 system is really only designed to kill biotoxins like molds, fungus, parasites, viruses, and bacteria. When it comes to something like lead, it can't kill lead. Lead is not a living thing. It's a toxin that's just sort of embedded in its fat cells. So now the Th2 system is trying to identify something that it can't identify, and it's creating antibodies to normal tissue. And now you've got an autoimmune disorder, because now the Th1 system is attacking the normal cells, and that's basically what an autoimmune system is.
So in a type 1 diabetic, that would be like the immune system attacking the beta cells that produce insulin in the pancreas, correct?
Right. And the question is, well, why is that happening? And that's where it gets really interesting, because it could be a biotoxin, or it could be a chemical of some sort.
A heavy metal or a chemical,
There's a really interesting documentary that I saw just recently that was done by Dr. Cousins. Dr. Cousins has a facility in Arizona called the Tree of Life, and what they do is they bring in diabetics, type 1 and type 2, and they put them on a 30-day raw food detox program. And the six participants that I saw, a lot of them went off all of their medication and all of their insulin. Now, the majority of them were type 2, but there was one type 1 diabetic that went off all insulin and all medication and stayed off of it. Mm-hmm. And what's interesting about that is, for me, is like, was the raw food diet the key that detoxed the system off of that antigen, and then the body could kick into high gear and start over.
Mm-hmm. Yep, makes sense. Of the patients that you see, would you be able to roughly say what percent of the patients that you see that suffer from autoimmune diseases such as diabetes or other autoimmune diseases, what percent of them are toxic, are suffering from high levels of toxicity
honestly,
in their system?
That's a really difficult question to ask, because to be perfectly honest, I think we're all toxic. Quite honestly. I mean, our clothes were not dyed with blueberries, right? So we're kind of ingesting all kinds of different chemicals, and they create new ones all the time. And your body doesn't really know what to do with those chemicals. They doesn't know what they are. So in essence, we're all really kind of toxic. With autoimmune disorders, what's interesting is a lot of times, most people that have an autoimmune disorder don't even realize that they have one. So take, for example, someone that's got a type 2 dominance in an autoimmune disorder. They might not even have any real symptoms, or symptoms that are identifiable enough for them to even realize that they have this going on. Mm-hmm. So there's a research coming out now that they think that heart attacks are really caused by an autoimmune disorder, like a type 2 style autoimmune disorder.
Interesting. So in your practice, you were talking earlier about supplements, using supplements. Do you find it necessary to introduce supplements most of the time?
A lot of the time, yes, especially if I'm working with an autoimmune disorder. Let me back up and talk a little bit about type 1 and type 2 again. So when you have an autoimmune disorder, those autoimmune disorders are going to be either type 2 dominant or type 1 dominant. Mm-hmm. So an example of a type 2 dominant would be something like cancer. Okay, so a lot of times these people have no idea that there's a problem until they're really having a symptom, and they're at stage 3 or stage 4 cancer. A type 1 autoimmune disorder might be something like Lyme's disease or Hashimoto's, where the body is firing and trying to kill something that it can't kill consistently, and there are symptoms all over the place. Now, in terms of supplements, you have to be real careful about what you're giving. So, for example, you really want to identify, is this person type 2 dominant or type 1 dominant? And there are blood tests in order to do that. If they have a type 1 dominant, what means you want to create balance. You want to increase the type 2 dominance of that immune system. And you can take things like grape seed extract, green tea. There's different kinds of like pine bark supplementations that you would want to use. If you had a type 2 dominant autoimmune disorder, you want to increase type 1. So things like to increase type 1 dominance would be something like garlic, echinacea, vitamin C, all your antioxidants, cat's claw, those kinds of things. So depending on what I'm working with, it's going to make a big difference on what I give. So if I was working with somebody that had cancer per se, and I don't treat cancer, but if I were working with somebody with cancer per se and they have type 2 dominance, I want to increase the type 1 so that it'll take over and start defeating that cancer.
Now, do you get down into more complicated things where you have to decide what combinations of these things to?
Yes, I personally, that is how I go about, because what I try to do when I'm working with somebody with an autoimmune disorder, what I like to do is create a plan that's specifically designed for them. Mm-hmm. And people say, well, how do you possibly do that? I use a technique called muscle testing to identify what the antigen might be and how to detox them off of that antigen, and then how to repair the immune system. Mm-hmm. So whether Th1 or Th2, and then how to create balance within that system.
Well, that's interesting. So I've often wondered how you decide what kind of supplement to get when you walk into a grocery store and you see these shelves of 15 different types of one supplement and 20 types of another. Right,
it's tricky, and especially when you're dealing with these kinds of autoimmune disorders, you could be taking the wrong thing. So for example, if you have Hashimoto's and you're taking green tea extract, it could really make you worse. And then there's this confusion, well, I don't know what I'm doing, I don't know what I'm taking. And you're right, there's supplementations all across the counter, and how do you know which one is for you? What I do personally is I will go through certain supplements that I use personally, and I will actually muscle test. Does your body want this? No. Does your body want this? Oh, yes, it wants this. Okay, how much does it need? It needs this much. That's just how I go about doing it. There's lots of ways to identify. Mm-hmm. You can do blood tests. You can do a takeaway method where let's put you on this and see how you do. That didn't work. Okay, let's take you off of it. Let's put you on this one. Mm-hmm. Let's take you off of it. I just like to get real specific, and I believe that the body has a way of telling me what it needs and what it doesn't need.
So it sounds like if you can find the right supplement or whatever, that would aid in helping to get rid of the toxins that somebody's accumulated over time.
Yeah, exactly. And one of the big things in health is really where we all start is detoxing.
Interesting. So if you're seeing, on average, if you're seeing a patient, say weekly, mm-hmm. I know in today's world where we're communicating with two-word texts and this kind of thing, everybody wants everything right away. So if you're treating a patient, one of the things I want to get to in this is that there's a time period that it takes for a person to detoxify, and if they're going to heal, begin to see some results in terms of healing or getting better or whatever. So on average, when you see patients, what do you tell them up front in terms of setting their level of expectation that this is going to take?
This is going to take some time. Yeah. Right. And unfortunately, everybody's different, and there's really no easy way to gauge what's going to work for one person and what's going to work for another person. What we do like to do is start with, what I do personally is I want to figure out what the person's stomach is doing or what their gut system is doing, because 80% of your immune system is really in your gut. Mm-hmm. And so a lot of times it's your first line of defense, and a lot of times, to simply put, it's broken. So we really kind of want to repair that gut system. And then from there, we want to detox the system. And then from there, we want to rebuild the immune system. And that takes time. And I try to tell people you really need to give this a good 6 to 12 months and being committed to it, because it could take that long. Now, a lot of times, people's symptoms will get better immediately. Within 30 to 60 days, people's symptoms can subside and they feel great. but you have to sort of train that system to hold that balance. So it's like re-educating the body, and that can take some time.
So when you're talking about a 6 to 12 month period, that's really not a lot of time when you think about how many years it potentially took that patient to get to the point that they're at.
Right?
Yeah.
Here's a really interesting example. I would really recommend your audience to take a look at this documentary because it is interesting. The documentary that Dr. Cousins put together is called Simply Raw, 30 Days Back to Health. And what was interesting is there were 2 type 1 diabetics on this research project, and they put them on a raw food diet for 30 days. The one diabetic that got off all of his insulin and all of his medication had only been a diabetic for a year, I believe. So it kind of made sense to me that it would be easy to sort of reverse that. Now, the other one had been a diabetic since the age of about 10, I believe. He did not get off all of his insulin, but he did go from 70 units down to 5.
Units
now, if
of
he were
insulin
to continue, which is a significant difference.
Yeah, that's a huge difference.
If he were to continue with that program, who knows what would happen. Yeah. And, but it also could be that because of the duration of time, he maybe have to be on some sort of insulin forever. But if it's just 5 units or 2 units, that's a lot better than 70.
Yeah, absolutely.
You know,
especially when you're talking about having to use a synthetic hormone,
right.
Over the long term. The less of it you can use, probably the better.
The better, right.
Yeah. And of course, on this show, I also want to stress that if somebody's going to check into that study, they should definitely tell their doctor about, I'm looking at this study.
Absolutely.
And if they're interested in trying to do something like that, to make sure their doctor's informed that here's what I'm going to do, so the doctor can help them with potential adjustments to insulin or other medications that they're taking so they don't get a low blood sugar and fall on their face.
And if I remember correctly, Dr. Cousins is a medical doctor. He is a medical doctor, and he does regulate them on a daily basis. But aside the fact, you should definitely talk to your doctor and tell him what you're up to if that's the choice that you would make.
Yeah, okay. We talked about the different types of, the 2 different major types of chiropractors. Over time, where has chiropractic work, how did it get to the point it is now, and where do you think it needs to go in the next 5-10 years?
Well, like everything, things evolve.
Yeah.
And like I was mentioning before, as people, it seems like we're really getting sicker rather than healthier. If you look in terms of cancer, in the 70s, when Nixon put the war out on cancer, we went from 1 out of 21 getting cancer to today, which is 1 out of 2 in men and 1 out of 3 in women. So we're not getting healthier, we're really getting sicker, and we're lasting a lot longer. So I think what's happening is chiropractors are seeing this market or this change in the profession that we need to really help these people because nobody else really is, especially when it comes to autoimmune disorders. As you well know, people aren't really getting the help that they need. And so chiropractors have started to take on that role and trying to figure out where's the problem, where's the root of the problem, and how are we going to switch and change that. And it's really been our philosophy since the beginning of time. Chiropractors have always been about, I don't want to put a Band-Aid over the system. I want to fix this. I don't want to put a Band-Aid over the symptom. I want to find the root cause and see if we can do something about that. So where we're going.
Well, I just wanted to interject one thing here too is with regard to diabetes. I just last month heard the executive director for the International Diabetes Federation on, and they got their new global numbers out of the number of diabetics, and it's 370 million now.
That's what I've heard.
And we've got an 8% increase a year.
Right.
So you're right about people are getting sicker, and nothing's changing.
Nothing's changing.
That's continuing to happen.
And so, some of us are identifying with that, and we're really wanting to make a difference. And so, I think what's really happening is you're seeing these evolution and these things changing. There's a doctor out there named Dr. Ted Carrick, And Dr. Ted Carrick is the guy that sort of created the whole functional neurology program. And some of the things that he's doing is just phenomenal with traumatic brain injury. And in fact, he's got a piece on the internet with 2020. It's a whole news program, and it's really interesting to watch. It's really interesting to see where chiropractic has gone since adjusting the back and making the pain go away versus treating traumatic brain injury.
Yeah.
So I think that's kind of occurring. And then you've got the other side of the metabolic system where people are starting to get into functional medicine. And for me, what I like doing is combining the two. When it comes to things like autoimmune disorder, you've got a metabolic problem going on. That metabolic problem, for what I've seen, will override the nervous system. So you really have to start treating the metabolic system before you can really treat the nervous system. Because you could have a pain, but if you've got an autoimmune disorder and your immune system is really trying to aggressively attack this, it's going to take a very long time for that pain to go away, because the body can only do so much. So I think that's where the evolution is occurring. I think that you're going to see chiropractors sort of filling the market and really starting to take care of people that really want more. There's a lot of people are getting very disenchanted with our healthcare system, as we have seen what's been going on in politics. So I think that's what's really happening. I think that's what you're going to find is people taking on these greater roles of functional medicine and functional neurology.
Well, this has been a really interesting interview. I think it's provided a completely different perspective on what people can expect if they go to see a progressive chiropractor like yourself. And I wanted to get that across here. If people want to get in touch with you, what's the best way to get in touch with you?
The easiest way to get in touch with me would be through email. And I don't have a website at this point in time. It's a choice that I've made. But the easiest way to get in touch with me would be chirocoast@yahoo.com. That's just one word. So CHIRO coast@yahoo.com.
All right, great. Well, Dr. Brannigan, thanks a lot for being a guest on the show.
Thanks for having me. I
appreciate
it, Patrick. It was fun.
All right. In this interview, I've attempted to show that chiropractic care, combined with things like proper exercise and nutrition, may be helpful to diabetics as a supplemental wellness treatment for two reasons. One, to eliminate nerve pressure that may be causing improper communication between the brain and the pancreas. And two, to relieve restricted blood flow to the pancreas and other major organs, ensuring optimum functionality through proper delivery of oxygen and nutrients. Also, as chiropractic care continues to evolve, progressive practitioners such as Dr. Brannigan are broadening their scope of patient observation so that they are better able to recognize health issues related to neurological disorders, autoimmune disease, and biotoxicity. As a result, these chiropractors are becoming more adept at integrating their work with medical doctors, naturopathic doctors, and other healthcare professionals. Again, I encourage you to visit my blog at www.diabetesa1cforum.org and share your thoughts or comments regarding this show. Thanks for watching, and I'll see you next time on Diabetes A1C Forum.